there are few important qualities which are required for the any profession, but especially for the profession of the medicine. And one of the important things is character. So the character is not something which you do when others are watching you. It is something like what you do when others don't watch you. So like after becoming a doctor, like you may be like saying to your patients like please don't drink or please don't smoke, and for that like you should be following that like from the day one. The reason I am telling this is that I would like to tell a small like anecdote. When our Gandhiji was asked by a mom like bringing a child to tell him not to take sugar, he told that you come after 2 weeks. So after that, the mom came with the child, and then Gandhiji told, uh, like please don't take sugar anymore. And she was asking, you could have told this earlier 2 weeks ago. Why you are telling it now? He was telling this. First, I should stop taking sugar, and then only I should tell others. So it is not a simple story of ethics, but it will be very much appropriate for you doctors. If at all you are going to preach anything to your patients, please practice the like first. Like for example, having the right meal at the right time, and also taking care of your health and taking care of your wellness, like both being like physically and mentally, and also taking care that you follow a discipline schedule in the day-to-day life and also across the lifetime. So this is something which I always reminded that at SRM we believe that discipline and character are quite important, and that is why we always emphasize that if the students fail to follow discipline in the campus, we will take stringent actions. But the reason I am telling this is that apart from being a doctor or like you studying for this MBBS education, as a student, if you like fail to do or fail to have any disciplinary character, then we may have to take the stringent actions, and at that time you should not feel that you are not told about this. So like more than the competence, we feel that the character should be maintained by the student, and that is why we have a separate directorate called the Directorate of Student Affairs. If you have any problem for yourself, so you can always go and talk to them, and also you can always talk to your faculty mentors and also your teachers at any point of time. Like this as character, I feel the another important thing which is needed in like any profession and especially in medicine is competence. So competence is not only about knowing like and also securing marks in the examination you are facing, but also giving your overall knowledge for yourself at the end of the degree. So I just reminded of the anecdote when I was and I and my daughter was going to a temple, and the executive officer of the temple was asking my daughter like what is she doing. She said she finished her MBBS, and he asked her like whom do you think is the person who is closest to you. Normally we always feel that the people say it is the parents or something like that, like father or mother. And in fact, like he was telling, of course, like she said the same, but he was telling that it is your body which is quite important for you. and that this body is the one which came with you and which is going to go along with you. So should be protected at any cost, and the health is very important. If we are giving this body which is so precious to somebody to take care, it is only the doctor. So he was coming to the fact that the people are surrendering themselves to the doctors because they feel that they are confident that they have the competence to do so. So I think you should understand the fact that the people coming to you are because of your competence in education and also competence in your experience and your the clinical skills. So this is quite important for you. And beyond this, I would like to say, for anybody, it is important to have a commitment towards what they are doing. The commitment which you have right now is to study well and to go any extent to do that. Here, as we have been telling, you will have a lot of opportunities for studying the various subjects. But apart from that, you should also study the clinically very close to the patients. That is very important. And the fourth thing I would like to say is compassion. And when I talk about compassion, I'm reminded about the message which I received during the COVID times. In the COVID times, there was a message saying that the temples are empty is because all the gods are very busy in serving the people in the form of doctors. So that is the compassion the people out here feel that. So I think you should have that kind of compassion in you, and you should feel that it is exhibited all the time, not only after becoming doctors, but also right from the day one as you start your career as the MBBS students. And the fifth one is communication, and you would have seen any things which are happening any untoward things which are happening between the doctors and the patients or the patient attenders. It is all because of the problem of communication. If you are very clear and open and you are telling the patients or the patient attenders what is happening then and there, then this problem would not happen at all. And you should also understand that you are not treating the disease, but you are treating the patients. So that is very important, and keep communicating. And I would like to say that, or even extend to go further to say nowadays your competition is not going to be with another doctors, it is going to be with the technology. For example, in the chat GPT, if you give us symptoms and the blood test, it will give you all the possible diagnosis. So as the technology grows, you may become irrelevant if you don't have compassion and if you don't communicate to the patients very well. So this is very important, and you should understand this very well. So as I said, these character, competence, and commitment, compassion, and communication are the 5 C's which you should always remember across your studies in SRM. And it is not only for your studies here at SRM, but also in your career beyond that.